If you're watching this, you're probably at a crossroads. You've noticed thinning at the temples, more scalp in harsh lighting, more hair in the shower drain. And now you're asking yourself one question: is keeping my hair worth altering my hormones? Today, we're cutting through the noise. No hype, no fear-mongering, no blind reassurance, just science, the side effects, and the honest uncertainties surrounding finasteride. Quick disclaimer before we go any further. I need to say this clearly. I am not a doctor. I'm not a physician. This video is based on publicly available medical literature, clinical studies, regulatory updates, and reported patients' experiences. This is educational content. It's not medical advice. If you're considering finasteride or any other hormone-modifying medication, consult with a professional. Now, let's get into the biology, the science. What is finasteride? Finasteride is an oral medication originally developed to treat prostate enlargement, but researchers noticed something interesting. Men taking it stopped losing hair. The reason comes down to one molecule, DHT, dihydrogen testosterone. Why hair loss happens? Most genetic hair loss, also known as androgenetic alopecia, is not caused by low testosterone. It's caused by sensitivity to DHT. Think of your hair follicles as tiny engines. In some people, those engines are genetically programmed to overreact to DHT. When DHT binds to receptors in the follicle, it slowly triggers something called follicular miniaturization. That means the growth cycle shortens. The strands become thinner. The follicle shrinks over time. Eventually, the hair becomes so fine it's almost invisible. The follicle doesn't die, it shrinks. Where DHT comes from? Your body converts testosterone into DHT using an enzyme called 5-alpha reductase. There are two main types of this enzyme in your body. Type 1, mostly in the skin and liver. Type 2, concentrated in hair follicles and the prostate. Finasteride selectively inhibits type 2. So instead of testosterone converting into DHT, the process is blocked. What that means biologically: within weeks of starting finasteride serum, DHT levels can drop by almost 60 to 70%. At the scalp, DHT levels drop significantly as well. That interruption slows miniaturization. In clinical trials, around 80 to 90% of men stopped losing hair. Many experienced visible regrowth over 1 to 2 years. Biologically speaking, finasteride is extremely effective. But here's the nuance. DHT is not useless. It plays roles in sexual function, mood regulation, neurosteroid production, development of male characteristics. When you suppress a hormone systematically, the rest of your body notices. And that's where the conversation shifts. The side effects. What the official data shows is that in controlled clinical trials, sexual side effects occurred in roughly 1 to 4% of users. These included decreased libido, erectile dysfunction, reduced ejaculate volume. In many studies, the rates were only slightly higher than placebo. That context matters, but clinical trials don't always capture the full picture of real-world variability. Why sexual side effects can happen. DHT contributes to androgen receptor activation, nitric oxide signaling, libido pathways. When DHT drops sharply, some individuals report reduced spontaneous desire, less intense orgasms, change in erection quality. For many, these effects reverse after stopping the medication, but not always. And that's where things become controversial. Mostly observed as hormonal shifts and gynecomastia, when DHT decreases, some testosterone may convert towards estrogen. In rare cases, this can lead to breast tenderness, minor tissue growth, hormonal imbalance symptoms. These cases are uncommon but documented. Effects on mental health. This is where the discussion becomes more serious. DHT influences neurosteroids, including compounds that regulate mood and stress response. Some post-marketing reports have linked finasteride to depression, anxiety, emotional blunting, suicidal ideation. In 2022, regulatory authorities required suicidal ideation to be added to safety warnings. That doesn't mean it's common, but it does mean it was significant enough to acknowledge. And when mental health is involved, even rare matters. The PSA effect. Finasteride lowers PSA levels by approximately 50%. PSA is used to screen for prostate cancer. If you are taking finasteride and your doctor doesn't know, your PSA reading may look artificially low. Physicians typically adjust PSA interpretation for patients on the drug, but only if they are informed. Transparency with your healthcare provider is imperative. Now, we need to address what many online forums discuss: Post-Finasteride Syndrome. PFS refers to persistent symptoms that continue after stopping the medication. Reported symptoms include ongoing sexual dysfunction, brain fog, inability to feel pleasure, emotional numbness, hormonal irregularities. In some reports, symptoms begin after discontinuation. Why it's debated? There's no universal medical consensus yet. Some researchers propose long-term changes to neurosteroid. Others argue that psychological expectations, known as nocebo effect. So the honest answer is this: we don't fully understand it yet. What do we know? Most users tolerate finasteride well. A small minority report persistent issues. Regulatory agencies acknowledge reported risks. This isn't hysteria. It's an evolving area of medicine. So, how do we approach this? Before we close, let me say this again clearly. Nothing in this video replaces medical evidence. Everyone's hormonal baseline is different. Everyone's mental health history is different. Everyone's risk tolerance is different. What works perfectly for one person may not be right for another. Your decision should be made with proper medical supervision, not just YouTube video, not just forums, not just fear. Here's the balanced perspective. Finasteride is one of the most effective hair loss treatments ever developed. For many people, it preserves confidence and significantly improves their quality of life. But it's also not a cosmetic supplement, it's a hormone-modifying medication. If you're considering it, get baseline blood work, understand your mental health history, start informed, not anxious. Monitor changes carefully. Work with a physician who listens. Your hair matters, but your mental clarity, your emotional stability, and your long-term health matters more. Real power isn't choosing blindly, it's choosing consciously. If you found this video helpful, give it a like and share. Thank you for watching.